It's gonna be good. It's gonna be great. It's gonna be better. I can't wait. Making my move. Live for the day. Sing like a bird. Fly like a plane. Come spill with me. Jenny D.
Hello, my beautiful people. Thank you for joining me with another episode of Spill With Me, Jenny D podcast. Today's podcast is brought to you by Clair Health, and we are here today at Clair Health, and my guest today is Dr. Kyle Duff. Dr. Kyle Duff practices here at Clair Medical Group Internal Medicine, and I'm just so excited to have you here today and to take the time to talk to my listeners and my viewers. But before we dive into these questions, we would like to know a little bit about yourself.
Let's see, what can I tell you? Thank you for that introduction. I'll just add that I'm a native to Southern California. I grew up in Ventura. I came to Pittsburgh in 2011 to go to the University of Pittsburgh School of Medicine, where I graduated in 2015. I completed my residency down in Washington, Pennsylvania, little Washpaw.
Yeah.
Just 3 years in that program. And then in 2018, I broke out into the world of independent attending doctor. And I worked for two great organizations in the Washington area. And now I'm in an even more stellar organization up here in Mount Lebanon, PA, Clair Health.
Yes.
And
this has been how many years you've been practicing?
Out of residency, I've been a little more than 6.
That is wonderful. I know when we first met each other, I said, geez, Dr. Duff, you are so young.
We all start off this way. You may not meet a lot of us, but yeah, I get that. Thank you for that compliment.
Well, thank you. And I'll tell you what, don't you think that the medical center here is it is so great. I mean, it's one of the best.
Yeah. From the top line education that you can get in the city of Pittsburgh all the way to the surrounding hospitals. It's a great place to be in healthcare, both on the working side and if you're a patient. You can get every level here. And I work at the primary care level. So I'm your some people say GP or general practitioner. Some would say PCP. But as a family doctor, I'm seeing all ages, and my focus is on every age and stage from healthy to sick you might go through.
I love that. That is so true. Because if you think about it, we always say primary care, and a lot of times it's a family medicine. So it's a family doctor that can see children up to what age? Would you say?
Oh, all the way through the life spectrum. My training was I delivered babies, and all the family doctors learned to deliver children. Yeah. In residency, I think I delivered 36 babies. And then we learned to take care of the child from that very moment. We go over to the warm room, we're helping them to take their first breaths. Yeah. If they're in distress, we're helping them to resuscitate them. And if they need to transfer, and then they take care of the mother from her, both when she was pregnant and afterward, and then they might turn into our patient someday.
Oh, my goodness.
After that. That's the joy of being in family medicine, is having that touch of life from birth until death. That's been what really excited me about family medicine. Right now, my practice is in an internal medicine practice. So kind of splitting hairs a little bit, but I mean, other medical folk will know that family medicine sees all ages, while internal medicine sees primarily adults.
Okay. I'm glad you told me that. I would have never known.
Yeah. So I do see a lot of adults right now and not as many kids, but I came to Clair to work as a faculty member for residency programs that will be starting in July of this year.
Okay.
Which is really exciting too, to train other doctors.
Well, okay, so talking about primary care, many people think they should only see a doctor when they're sick. And why is it so important to see a primary care physician, even when you're feeling healthy?
Yeah, that makes total sense.
I know.
It makes total sense, a doctor for when you're sick.
Right.
But who do you see when you're healthy? Well, the answer is still a doctor, mostly because things that can affect your health down the line aren't always things that you detect. You're aware when something on your skin changes. You're aware when you feel pain. You might notice that you're not as perky as you once were. Your energy levels are down. That's stuff that you'll go and see a doctor about. But you might not know that your blood pressure is a little high or very high. Your body has ways of adjusting and keeping you from being aware of that.
Right.
Until, unfortunately, that blood pressure left unchecked could lead to problems like kidney failure or a heart attack. we're there to detect those subtle changes in your body by way of examining you, looking at blood work, measuring your weight, to see whether your course of your health might go south and steer you past that, because little changes early in the course of a disease process make big changes down the line. And we see that from every angle in the practice of internal medicine, which involves seeing people in the office and in the hospital, from usually doing okay, doing well in the office, to not doing great in a hospital.
Right.
We see what feeds into those two different states. We see the whole spectrum, the episodes of health, from well to not, and then back again. And it's not even I can't on my own as a person know when I have a small, subtle problem, like my cholesterol's too high. You don't feel that.
Right. You don't feel that.
So you need a doctor and or an APP, someone that works alongside a doctor, like a PA or a nurse practitioner, to help you detect that early so you can make the right changes.
That's so true, because I think a lot of people don't think about that. They want to, sometimes I don't want to feel like, oh, I'm going to the doctors too much, or this is a stupid question, or I don't want to be, bothering them. I think that's a lot of times people don't want to do that as well.
We want to be bothered by you. We want you to bring the thing. Yeah, we're going to clarify what things you can or should worry about, and those things that probably are less worrisome. We don't have answers for everything, but I know that other thing that keeps people from coming in, there's a whole list of why people might not be involved with their primary care doctors, is because they don't want to hear bad news.
Right.
Yeah. Or be lectured to, which I know a lot of people have experiences with.
Yes.
Yeah.
It's true. And it's January. So, it's primary care month, and we want to make sure people know that, just go see your doctor. You got to get that physical at least once a year. Would you recommend a physical?
I would recommend a physical for most people once a year, even if you are very healthy or you take care of yourself or you're fairly young. Particularly if you are someone who receives a state or a federal kind of insurance, like a Medicaid package or a Medicare plan.
Right.
They really want to check in with your health at those pivotal moments, like once a year. It's good for you, for sure, but it also benefits our knowledge of what things are affecting our society. That data, and without your name attached to it, gets put into systems that help us to improve care for everybody. So you participating actually improves public health, believe it or not. And it sets out priorities to some extent for what we need to be doing for Americans.
Right. Oh, see. Now, we probably already answered, what role does primary care physicians play in preventative care and overall health? Because you were saying before, you could see the symptoms earlier. You could detect something that they didn't even underlining that they never knew they had.
Yeah, for sure. That is our whole business in primary care, is looking at how we can prevent other things from coming on. We take into consideration, like when you go to a physical exam, you get your vital signs taken, blood pressure, your height, your weight. That gets put in the chart, and then we look at the medications you may have already be taking, or where you brought your care from someone else, and we do a review of it. So if you've been on a primary care, maybe getting your medications from some other place, maybe you haven't seen a doctor in 2 or 3 years, but you're taking the same medicines. Sometimes you may not need certain medicines, and we can help you come off of some things that that aren't doing a job anymore. Or you might need something adjusted, a little tune-up, if you will.
Yeah, because that's the other thing is, like you said, if you're on something for so long, sometimes it's better to change it up or try something new, because you don't know what can work for everybody. It's different.
Yes. So
what can patients do in between visits with primary care physicians to ensure that they stay on track with their health goals?
Yeah, there's this changing paradigm, this view of how we keep people healthy when we're not seeing them. Your visit with a doctor, if you go once a year, maybe a 15 to 30-minute experience. That is such a small window into who you are and what your life is like.
Yes.
And some of us, I know, I can speak for many primary care doctors I know and have worked with, would love to spend more time in the lives of our patients if we could. There's just the demands of various forces, like our office needs and what the health system needs. We don't get a lot of time together. It's great to come prepared with the things that are most important to you when you come to those visits, so we can prioritize what's important to you. We'll also, as physicians and APPs, will have, and I keep using the term APP, which advanced practice partner.
Okay, I was going to ask you what that.
I didn't want. I'm trying to get as much as far from doctor speak.
Smart, like I knew what that meant.
There's lots of terms for those that help and do the work of primary care that don't have an MD or a DO behind their name. They may have a PA or a CRNP or a DNP behind their name, and they are as important as I in your care. And you may end up seeing one of them instead of a quote, doctor, but those people are as capable of carrying out a primary care visit as I am. And we collaborate all the time. So whoever you're seeing, whatever their credentials, they're going to come in with some priorities for you based upon certain things like your age,
right,
your prior care. If your blood pressure's high, they might have that to talk about. We try our very best to balance the things that you want to talk about with things we need to address, because there are some things that can't be overlooked. And it's hard to communicate to people, our patients, when something like a high blood pressure is really, really pivotal to handle. And so if we can both come in with a little bit of understanding of that you have your list of priorities and I have mine, it'll make for a really productive visit. And then, that happens. It's 15, 30 minutes.
Right.
And you go home and you may get a new medicine added on. You may be told to follow a certain diet. Maybe you get a test that you're a little afraid of the results. And getting that taken care of in the time that the doctor or APP recommends is pretty important, because letting things linger too long. I mean, if they say, you need the scan of your lungs in the next 2 weeks,
right,
barring the insurance company telling you, well, you're not qualified until such and such time, letting that sit for 6 months could mean that something could change or grow in a bad direction. So getting your labs, your imaging, those little homework assignments
right,
done, and at the timing that your clinician tells you is really helpful, because then we can give you as close to the time feedback in real time, if you will. But there's so many things that happen in your life that change your health too. Like you may lose insurance. You may move to a different area of the country or of town, and you may change jobs, and that changes your insurance. And that can lead to a lot of discongruence in continuity of care is broken.
right.
And for a lot of people in America, forces like that, and then the COVID-19 pandemic really pushed people away from belief in modern medicine or the healthcare system that we have in America.
Yes.
There's lots of studies on the levels of trust before and after the pandemic. They've fallen by more than half. I mean, there's between maybe 20 and 30% of people trust American healthcare anymore. Oh, absolutely.
Oh, I didn't even realize that.
Yeah, and it's any one person's fault as to why we've lost you and your trust, but working back on that, I think, is we have to acknowledge that trust has been lost and that something has to be brought back.
Right.
And I know that if I'm to suggest or even strongly recommend something to someone in my office and we don't have a trusting bond, it's unlikely that out of my visit with them, they're going to do what I asked. And I can't blame them for that, because if there's not a mutual understanding, if I'm not showing you respect, if I'm not understanding the forces behind your life that make it hard on you to follow instructions, if I'm not showing that respect back to you, why should you listen to me?
Right. I believe, I just changed primary care doctors. And that's the other thing, is, you don't have to have the same primary care doctor. If you want to change, sometimes people are afraid of change.
Oh, very much.
But you go to someone else and it's like, whoa, wait a minute, they see something different, or maybe they bring something different to the table, and you're like, you know what? So I'm very excited to change and to have somebody else. And especially, when we're going through different phases of our lives, women are, and different things like that. It's nice to get somebody else's perspective. But when we were talking about, health and wellness and New Year's resolution, speaking of health goals, I know, right? A lot of people set wellness-related New Year's resolutions. How can a primary care physician help patients with goals like weight loss or reducing stress?
Ooh.
I know.
Tough stuff.
It is tough stuff.
Yeah.
We set ourselves up for this, we're going to do this, we're going to do that. And it's so hard to follow through.
Really. I bet some of you out there listening to this now in roughly late January 2025 have already tried and maybe even let go of some of those goals you set for yourself.
Not I, no.
Oh, you're the strong one?
Yeah, because I'm not
you're the survivor. I got to ask, Jenny, did you come into this year with anything that you wanted to change for your health? Was there anything that you picked out?
Yes, I definitely wanted to start thinking about what I'm going to eat before I eat it. Because sometimes I think, I just want a snack, so I'm just going to grab something. Instead of thinking about what it is and what it's going to do to my body before I put it in my mouth. And it's taken me this long to realize that.
That sounds like intuitive eating.
Yeah.
Yeah, thinking of just pausing a little bit and figuring out, like,
am I that hungry for this? Do I need this, in my body? Like the sugar.
Yeah.
Taking away some of the sugar and some of the carbs and that are not good for me.
Do you ever eat out of boredom or emotions?
Yes, I do. And I'm going to try to not do that either.
You're going to try not have emotions or be bored?
Yeah, right.
That'll be the solution. Never be bored again.
I am just going to be like, I'm not going to have any facial expressions. Yes.
I'm going to find distraction all the time. Well, to answer your question, thanks for answering that question I gave you. But to answer yours, we're all about that. We're all about you trying to set your own goals. I think a goal that you set for yourself is the strongest goal that you could. I can tell you up and down what I think that person of your quote demographic or your time in life needs, but without knowing you, I could never recommend something that's really catered to you. So I would like any patient to bring what their goal for themselves is to me in honesty, even if it's like a high flying goal, like a dramatic weight loss or a change in exercise, be that what it may. All kinds of ways to define wellness, by the way. People talk about weight and a lot of conversation around weight. It's all we talk about and especially with the diet drugs that are now available.
Yes.
Which I do prescribe and could talk about if need be, but just in a more general sense. We want to start from where you find your goal and then break that down into smaller incremental goals that you can reach in little stages, because you'll need that to keep yourself encouraged. And putting that goal into kind of like specifics with measurable goals, they may be measurable by blood, they may be measurable by your blood pressure, maybe by a measure you use, a number you use, but time sensitive. By what date do I plan on doing this? Let's say it's quitting smoking. Well, I want to quit smoking. Well, do you want to go cold turkey, or do you want to cut back by a little bit? Do you want to do a cigarette every week, or do you want to do a quarter pack a day, like off? Like, how dramatic do you want to be?
Yes.
And then we can tell you, like, well, in my experience, this is the doctor or the nurse practitioner talking to you, that's a really tall order. You don't have to go that fast. If you wanted to try going this a little bit slower, and then we can meet regularly along that path. Hopefully, there's enough space in the schedule of the clinician to meet with you, or you can refer that person to a person who specializes in that, such as, say, a dietitian, to meet with you more regularly about your goals. We can set that up for you.
Right.
And then, so being realistic, breaking that down into smaller goals and how we're going to measure it. And then perhaps, and this is like I say, the bottom of the list of priority is there a therapy or a medication that is evidence-based that will help you get to that goal? Be it a diet drug, a drug that helps you with your cravings around smoking, or maybe helps you to quit alcohol. Those exist and they work, but they only work if the person is motivated and wants it from themselves, not because the doctor said so, because you want it, and that you have a system of support to get you there.
It's so true. And, you're thinking about New Year's resolutions, and I know, like, okay, so you go see your primary care doctor, and, Dr. Duff says, oh, okay, you look good, everything looks good. And then all of a sudden you're like, I'm going to do this. And then a couple months later, I'm like, I didn't do what I set out to do. So that's like the other thing. It's like, when you fall off track with your, health related resolutions, trying to form these new habits, what do you say to them? Like, they don't want to come back because they, so a lot of times we feel, mad or, at ourselves, and we're kind of embarrassed.
Yeah. If you've been in the healthcare system long enough, you've probably been at least chided, if not shamed, for not being something that the doctor wanted you to be, or to get somewhere that you'd set out, or they'd set out for you to do. And that kind of attitude, it's not going to get you where you want to be. It really tears you down. You might also just be getting that from people in your life, like your parents. People expect things of you. We're constantly beset by expectation, and with the now, you can't even call it the rise in social media. It's in our DNA now. Social media sets the tone for a lot of expectations, especially physical, visual expectations, success. We're all being pushed to meet a standard. And so when the doctor or the nurse practitioner or the PA adds to that, you don't want to come back and hear that old, it's like beating a dead horse. Right. Hopefully the person who takes care of you in the office is compassionate to that feeling of exhaustion you have. Yes. And says, what could we do differently on a go around? Perhaps we just need to take it in smaller steps, not beat ourselves up too much. I also get patients who, for whatever reason, they want to fix more than one thing at the same time. They want to lose weight and quit smoking. admirable.
Right.
But I say, do you realize that when you quit smoking, you'll gain weight? Most people do.
Right.
Either from this not having nicotine, which suppresses your appetite and stimulates you, to the emotional, whatever the nicotine was doing for your emotions, you may replace with eating or drinking.
That's true. I didn't even think about that.
And so you'll see weight gain, and that's going to make you feel like you're a failure from the weight loss perspective. And then you might smoke to get the weight loss back when you're smoking again. These two things can play off each other. So if I'm breaking that down for somebody, I'm going to say, let's tackle one of these at a time, please. And don't worry about the other one right now. Pick one goal, because they're both hard to do.
Right.
And if we can get you to where your habits are different for long enough, and it might be months of a habit change, then we can talk about the next goal.
Right. Don't set yourself up for failure already. That's the hardest part is that, you have these high expectations and you see everybody else around you
seemingly doing it at a rapid speed, because a lot of these change videos you'll see are montages of look what I did in 3 months.
Oh yeah.
That's a hard journey.
A lot of the famous people, I don't want Kelly Clarkson or anybody. Oh, all of a sudden, within 4 weeks, she was
it seems like overnight.
40 pounds lighter.
Yeah.
And it's like, what?
Or movie stars that get ready for roles as superheroes, how they get really buff.
Right.
They had hundreds of thousands of dollars poured into that effort. And all they had to do for those 2-3 months before that role with the camera was turned on was focus on just that part of them, because they're an actor.
It's their lives.
That's their lives.
Occupation.
We have other lives, unless you are an actor, which I respect you too.
I'm an actress here.
But we have other priorities. And so it's going to be hard to make dramatic change when you're trying to balance all your other things in your life.
Yeah. When we talk about, primary care, how does St. Clair Health, specifically your practice, St. Clair Medical Group, internal medicine, I said that all and I didn't time to support individuals looking to make healthy lifestyle changes? I mean, we talked about, I hate the word diet.
A loaded term too.
Right. And I feel like in January, don't you agree too, Dr. Duff, that, we're not really doing a lot more exercise that we usually do in the spring and
not in the cold weather areas,
Maybe in California, where you
but that's more of a year-round lifestyle. It's a hard act to follow, but
yes.
You're right. What can our St. Clair Internal Medicine group do for someone who wants to get on board with some goals? Well, we have more ways than ever for you to get an appointment. Most people will call on the phone. You can go online and schedule an appointment. A lot of the scheduling links will take you to a phone number. But let's say you do a phone call with someone. We have openings within the week, if not next week. In our practice, I have patients who call, and within a week they're getting in for their new patient appointment.
Great.
Yeah, we're not overrun. We're not booked up.
We'll see you in 2026.
Right. We're happy to start your journey in healthcare and get you linked in. And once you are, the best way to be prepared for that visit would be to bring as many records as you have of your healthcare. No record is unnecessary or too small, but bring them with you. Even better if you can drop them off early in the office. We'd love to review those records, because that gives us a context in which to kind of continue your care.
Right.
If you've been out of care for years, haven't had a PCP since you were in diapers, then fine, we'll start from scratch. But we love having that context, because if we request the records after your first visit, then we have to do things kind of in reverse order, and it can be a little harder. It's more hours on our end. It is more effort on your part to help us. I understand that, but it really does help you to come with records that you've had before, recent lab tests, assuming you don't have access to that. And federally, legally, you do. You can ask your records from any source and get them.
Oh, that's great.
Yeah, your records are, and even the notes I write, the record I keep on you, you can request at any time. That is part of the federal act that made that possible. But you should be able to access your own records anytime and bring them. We have, after your visit, a packet at our practice that says, "Welcome to our practice." It's a grayish blue folder, and it has in it a bunch of pamphlets and forms that might help you, such as how to access the patient portal. We have an online portal that you can use to look at your records, look at your results that your stuff gets uploaded to. We have, if you need a reminder of how to make the most of your visit, we have a checklist there, how to prepare and what to do next.
Right.
Your health maintenance record, a medication list you can use, and then a little card for the hours and services for all of our imaging and lab draw services. All of our outpatient services are in this packet. You'll get this packet when you check out. If you bring this with you, you'll know before you go in what is needed. And we'll always provide you, by the way, a summary of your visit at the end, printed out for you, that shows what lab tests were ordered, imaging, and your medications if they got changed.
Right.
And you can take that and put it in your packet and bring it with you. And we'll always be able to, through the electronic health record I write in and this record that you carry with you, keep everything in the right order for priorities for your health and streamline your visits. So
I love that.
Those are all ways we can, as a practice.
Because that's the worst when you leave the doctor's office and you're like, darn it, I forgot to ask about, my foot was bothering me.
Bring it up the next time.
I'm that person, that commercial where it has all the Post-it notes all over me. I have this, I have that, I have this.
Yeah, don't rely on your memory. Do not. I couldn't do it. Don't rely on your memory alone to remember all the things you need. Write lists. We really like to see now a list of 10 things, maybe not,
right.
But we can rank, if you can rank those things in order, we promise you get to the top 2, 3, depending on the complexity things. And then the next things we'll always try to let you know, okay, 4 and 5 in 2 weeks or in 3 months, we'll certainly address.
Right.
And if we can't address it in our capacity as primaries, we'll know what specialist to send you to for that. We can always refer you, and you could be seen for that foot issue that you forgot until the very end. Oh, by the way, we have for example, a podiatrist in our health system that has walk-in hours. Ironically, walk-in hours, foot doctor.
Oh, yeah.
If you can walk in.
He's here all day, people.
If you can walk into that appointment, he will have his office hours, walk-in hours for 3 hours on Mondays. And it's just, you just come as you are and you can be seen.
Yeah, see, people don't know all that. Like, they think, I got to schedule. No, call and find out, because you just never know. I think a lot of us think that, like you said before, I cannot believe that you can just get right in with you within like a week or so, because I think a lot of us think that, it's going to be months before I can get to see Dr. Duff.
And that is the reality in some health systems for sure. We're a smaller health system, and this one, St. Clair, has existed since the 50s, has remained a community health system independent of other larger organizations. So when you call to get scheduled, you more likely than not will talk to somebody who's sitting in the office I work in. Right. And they may be able to run back and say, hey, this person might want to come in for this. And or they can send me a message. It gets right to me. It's not a centralized scheduler, at least at this time, that's devoid or separated completely. So the care is going to be very close to who you're going to be ultimately seeing, and it's going to be very timely.
That's so true. And I have the information here. So if you are searching for a new primary care physician to support your reaching your health goals this year, Dr. Duff and several other St. Clair Medical Group physicians are currently accepting new patients at the location throughout the region. So, you don't have an excuse. You can see a primary care doctor. Call the physician's referral line at 412-942-DOCS. And that to find your physician that is right for you, schedule it today. Seriously, mine is next month. I'm excited because, I'm like, with all those questions, I'm going to start writing everything down that I want to ask, because that's the worst feeling, is when you walk in and you think, oh no, I forget what I was going to ask the doctor. The other thing, real quick, I wanted to ask you this.
Absolutely.
I'm finding out as we age, a lot of times, and I had Dr. Was it something on about family health history, and my mom went to the doctor's just recently, and she found out this and this. I'm like, so now when I go to the doctors, I can add to that, like, hey, my mom has this, my dad's side has this. Do you know what I mean? Like, those kind of things are very crucial when you're trying to narrow down exactly what your patient.
Absolutely. There's genetic connections of lots of diseases, and you're aging at the same pace as your family. And if someone turns over and has, unfortunately, a new diagnosis of like a cancer, you want to tell your doctor, someone I'm related to by blood has this now. How does that change my possible risk? And then you can address it from there. But yeah, the family history is not a set in stone thing. It evolves with you too.
Right, exactly. Oh, thank you so much for taking the time today to talk to my viewers and listeners about primary care at St. Clair Health. I appreciate you.
Absolutely. It's been a real pleasure.
Thank you so much. Thanks for tuning in. And this podcast today was brought to you by St. Clair Health. Take care.
Be well.
Come spill with